Symptoms of COVID-19 occur either as a result of the damage that the virus is doing to your body or the actions your body is taking to protect itself. This is why you should pay attention to them. For example, we get fevers because cells which are infected with the virus will send out distress signals, which will in turn make the body's temperature rise to make it more difficult for the virus to multiply inside us. Or we cough and sneeze to try and eject the viral particles from our respiratory tracts. For most people, the symptoms of COVID-19 are mild to moderate and usually take around 5 to 7 days to appear. They include, but are not limited to, a high temperature, a new and continuous cough, or the loss of taste or smell. It is highly unlikely that you would experience symptoms for no reason, and this is why it is extremely important that if you think you even have one of these symptoms, that you self-isolate and get tested. During this time, everyone you live with also needs to stay home. The virus that causes COVID-19 typically infects the group of organs we use to breathe, but it can also attack other regions of our bodies, which is why symptoms can also include things like diarrhea or nausea. Both anecdotal and scientific evidence seem to suggest that a large number of COVID-19 patients suffer some form of long-term side effect of the disease. People who get symptoms are called symptomatic. People are called pre-symptomatic between the time of infection and the time that their first symptoms appear. There also seems to be a number of individuals that will be infected with the virus but will never develop any symptoms. These people are called asymptomatic. As mentioned, most people who are infected with the virus only get mild to moderate symptoms. However, some vulnerable people can experience much worse symptoms because their bodies, at that moment in time, are not well enough prepared for a viral invader. There are many reasons why a person may be vulnerable. For example, they may have a weakened immune system that means in the cellular battle, their body is at a disadvantage from the beginning, and the virus can infect many more cells, including ones further down in the lungs, which would result in much more severe symptoms like serious breathing difficulties. There is currently no effective treatment for these vulnerable patients, and their bodies cannot fight back in the ways that they should. This is why it is essential that we do what we can to prevent them from catching the virus in the first place.